Rachelle Schultz here again, CEO at Winona Health, with another update for you. On this update, it's kind of a paradoxical topic in some regard for all the preparedness that we've been doing, all the work, that's been in place, kind of what you're hearing, across the country about, hospitals being overrun and needing help and all of those kinds of things. And yet, actually, in many places, unless you're a hot spot, like the big metro areas of New York and Detroit and Chicago and LA and some of those kinds of things, most of us have just geared up and we're ready to go. And at the same time, we don't have a lot to do right now. And so we've had to make some organizational adjustments. What hospitals are experiencing here, certainly across all of Minnesota, but I know it's happening across the country as well, is we've all been preparing for COVID-19. We've been adjusting, our capacities in our hospitals. We've been making changes to our physical plant. We've been, bringing in more equipment and supplies and all of those things. So, there's costs associated with that. At the same time, and this is specific to Minnesota, although I know a lot of other states have done the same thing. We've had mandated reductions, meaning we've been told, and mandated that we cannot do elective surgery or procedures, that we've had to, cut certain services. There's, even with the business community, some of the businesses that have been closed by executive order in the state have impacted a couple of our services that have had to close. When we look at sort of essential types of things versus non-essential, there's some, impacts with that. And the net result of all of that is a fairly significant decrease in the volumes that are coming into our organization, whether that's on the hospital side, on the clinic side, any outpatient services, and so forth. I know across the state of Minnesota, that ranges from 40% to 70%. And in some services, over 90% of the volume has just been postponed, if you will, or just dissipated. This is causing, a lot of financial distress and concerns, for hospitals. There's work happening, at the state, the stimulus package, that Congress passed. Hopefully there's some reprieve in that, but that's yet to all be kind of flushed through the systems and so forth. So what we've done, similar to other hospitals, but trying to be really good stewards, both with our staff and sort of protecting our staff, as well as the organization, so that, we're here and ready, for the community, is a balance between, taking time off now, and being able to kind of surge quickly, if we ended up with a surge in terms of, COVID positive patients and that type of a thing. So we have been making adjustments. We have, been doing rotations with staff, with time off, with our staff and our providers. This goes from my role all the way through the whole organization, that we're all doing some reduction of our time to help, and do our part, to support the organization overall, and to be rested, ourselves, just so when we're called upon and have, long days, long shifts, for long stretches, that we're ready, for that. So you may be hearing, some of that out in the community. We just, talked with that, put that announcement out with staff earlier this week. Many had already been doing that. We've already been making adjustments over the last couple of weeks, but kind of formalizing that a little bit more, and continuing to look at how do we sort of protect the organization as a whole, which includes, of course, all of our people, but are being responsible, during this really tough time. So there's a lot of, preparations, but not a lot of volume, if you will, at this time. So what does that mean for you as patients? I think, again, we've been doing a lot of adjusting in terms of our schedules for clinics and various services. We are just moving out appointments, or we're moving out, surgeries to the future, postponing those types of things. Our clinics, starting on Monday, are going to be open in the morning up until noon, so we won't be open in the afternoons. And so we are going to be, if we have any appointments in those afternoons, we're going to ask people if they would reschedule those to the morning. We will continue to do virtual visits, which has tended to work really well, for some folks, so that we can make sure people can still, access at different times. Our urgent care will continue with its normal hours. So if you do have a need in the afternoon or whatever, urgent care is still available. We're still separating urgent care patients. Those with any type of respiratory or sort of infectious types of needs would stay on the main floor, and then we'll have a primary care, urgent care up on the second floor. So so urgent care is still available, for the hours that they had. Our pharmacies are still available, to those same types of hours, and of course the ED is always there. So we've kind of just need to shore up, where we are right now in terms of our expenses and and so forth. So with all of that, I want to just say just a massive thank you to our providers, to our staff. These are hard times. We know it's hard for our business community. So many of our businesses in our community have been, closed down and mandated also the same kinds of things. We feel that, maybe not to that full, same extent. Again, we kind of have this paradox of needing to ratchet back, but be ready, very quickly if we need to surge back up, whenever that happens. So we're kind of on this little bit of a teeter-totter, trying to figure out how do we balance that in the best way to be ready and ready to go for our community, and then also sort of protect our organization as well. The other thank you I want to give is to the family members, the spouses, the friends, the support network that's out there, partners, everybody who is supporting our providers, our nurses, our staff. You're equally important during this really sort of unprecedented time that can, potentially cause a lot of anxiety when we don't know. This is sort of invisible in some ways to us. And so I think the support that we have gotten from all of those folks has been pretty phenomenal to the well-being of the people who work here, and we are deeply appreciative of that, and want to just thank all of you for your part as well. So this was just a sort of a brief message just to let you know that we are making these adjustments internally. We are going to keep to the best of our ability, we are still here. We're still going to take care of people. We're still going to do all of those things. We're just trying to make it a little bit more efficient and consolidated right now during this sort of interim, time period. And we'll know more in the next few weeks. Hopefully, even by the end of this month, we'll see and we'll adjust again. So that's the world that we live in right now. And I want to again just thank our staff and their support structure for all of their flexibility in this really unusual time. So thank you.